So many of us go to doctors, but we don't know how to be good patients. That's why we have Dr. Susan Stone here, who runs comprehensive care programs for healthcare partners here to help us be good patients. And that doesn't mean we have to be docile patients. So what does that mean to advocate for ourselves?
To advocate for oneself means that you are in control of your person. So the very first thing that's important for our viewers to understand is that, number one, you're in charge. When you walk in there, you're not being directed. You demand
and you
a
want to ask
certain
lots of
level
questions.
Absolutely, lots of questions. So you want to have something to write on when you go. You want to have your medication list. And that means not the medications you're prescribed, but to actually be honest and tell the people in the office, the provider, the nurses, the medications you're actually taking, and if you really are taking the full doses. Some people do not take all of their medicine and they're afraid to be upfront, but it may be the medicine either makes you feel bad or you can't afford it, and so there's other options that we have rather than playing a game about
And there are
this.
some vitamins and supplements too that can be counteractive, is that correct?
Absolutely. I am a full supporter of any kind of alternative medicine, vitamins, herbs.
But you need to let your doctor know that you're on these
Absolutely.
things.
If you are on blood thinners, there are many medications that will interact with that, and that could be quite lethal.
I think the most important thing I would ask you with being a patient advocate is knowing your health plan
Yes.
and knowing how to use your plan and how to get the appropriate care, because oftentimes I don't think people know what's offered in their plan. So how do patients become educated about just knowing what they are and are not entitled to getting?
When you enter into a contract with a medical group, you need to know, and they should have an orientation session.
Okay.
And if they don't have one organized, you need to demand one.
Ask for one.
You have to know what's available. You may not know that physical therapy may be an option for you, or if you have a senior that you're taking care of, a parent, a spouse, that there might be home care services available to you, and you won't know that unless you ask.
I think that's a great question, because right now I'm taking care of my mom. She has vascular dementia, and I'm having to be an advocate because they did not want to give her the testing. So how far can a patient push? Because they'll say, you don't know what the symptoms are, but I knew that something was clearly wrong with my mom. So how far as a patient can you push, or an advocate for a patient?
I think that first, in the case of dementia, the biggest role I would say is that somebody absolutely needs to go to the visits with her, and it has to be somebody really, sometimes the caregivers, if you have a hired caregiver, they're not really the one.
They're just going to sit back and get you to the appointment.
Yes.
But
Now, would you want to write down questions first ahead of time? Because
Yes.
sometimes when you get into a situation, you get nervous and you might forget something. You think, oh, I should have asked
It
that.
happens all the time to us, right?
And I'll ask my family members, well, did you ask this? Well, what about this? Well, I don't know. And it's so frustrating.
Exactly. And so what happens is we don't want to set a plan with a patient who's feeling sick. Not just dementia, but if you're sick, then you're not going to be paying attention. And we really need somebody there who's going to be responsible, who is very, clear-minded, able to take in information,
Take good notes.
take good notes, and understand what the different options are.
And
There's
also
never
get the
one,
results from blood tests and things like that as well.
There's never just one treatment.
Right.
There's variations of treatments, and there's also alternative plans.
But Dr. Stone, with all the reforms to healthcare and Obamacare, it just seems like the patient advocacy is going to go down because there are going to be less options. And as a physician, who is going to be behind saying we still offer good health care? Is that going to be you?
Well,
who does that?
It's going to be the patient, right?
Yeah. It's going to be the patient. It's going to be their family. With Obama's plan, there's actually plenty of room. There's actually great stuff going on to get seniors more help in the community.
Okay. Well, I hate to cut you off, and we will have plenty of time, but we have to go for a break right now. But thank you, Dr. Stone, for being here with that. And we'll be back with more Every Way Woman.